What are you doing? I'm sleeping. So that thing that child is doing. Hello, beauties. Welcome back. So today, I don't know. I just want to quickly say something. You know, some people, if they don't know what is going on, some people like giving advice, and the advice is okay. You know, when it coming in a positive way, it's okay. But when it's coming in a negative way, trust me, it doesn't make sense. So, YouTuber that said in Arabic country, her name is Diana Ekweme. She posted something about her son. Delay in speech of her son is getting to 5 years or 5 years old, that not speaking well. I want to just quickly contribute something here. If you don't have, or if you have not experienced such things, you even know what the parents, maybe the mother, is passing through, or you will know whether they have gone several places for help. Coming to internet and be saying, then I take your child to this place, then I take your child to this place, then I do this, then I do that. Do you think that Diana is keeping quiet? There is no mother that will see her child not talking at 5 years, not speaking very well at 5 years, and keep quiet without seeking medical attention. You cannot tell me that Diana have not seek for medical attention. Remember, Diana's husband is a medical doctor. In one way or the other, they have seek medical attention. So telling her to do this, go to this place, check this place, yes, it's coming from a positive way, but we should remember that this woman will not keep quiet. As a mother, you will not keep quiet if your child are supposed to talk very well, interact very well, understand very well, he's not doing it, and you keep quiet. I don't believe that. And I just want to quickly drop this. If you have a child, no matter what the doctor or anybody tells about the child, yes, they are medical doctors, yes, they are medical practitioners, but you as a mother, you know who your child is more than everybody. That's why if you have such a child, they will give you a form to fill. They want to know everything about the child. Then the school, if the child is in kindergarten or in school, then they will still ask you to give the teacher of your child a form to fill for them to compare it. Do you understand? Then the school or the kindergarten will fill the form. Do you get? But coming to, trying to say, Diana, take your child to this, take your child to this. What we'll be asking Diana, have you ever tried to seek for medical attention? Of which I think he would do. She's not dumb. I think she should do that. Every child is different. The way this number A child is doing is not the way number B child is doing. And secondly, some children have delay in development. They have delay in development. Doesn't mean that there's something wrong with that child. It just that child has a delay in development. If you find out that your child has such delay, that child very well. The only therapy, even if you are going to therapy, the therapy is just 45 minutes. You are the mother has a lot to do in your child's life, not the therapist. The therapist can give you 45 minutes. I don't know where I am staying, in the country I am, that can only give you 45 minutes with the child. That 45 minutes might be 45 minutes in 1 week, once a day in a week. And once a day is 45 minutes. So as a mother, what would that 45 minutes do to that child? That's what I'm seeing is I don't know another person. What was that for this? So you have a lot to do on your child. And if I have a short child that has a development that is not attached with autism, delay in speech can be a signal of an autistic child. But if you have the child has a delay in development, then you have a lot to do. One, after going for therapy, if you want to go for therapy, you can. After going for therapy, you have to interact with that child. Don't allow that child to be watching. Remove every gadget from that child. Everything, phone, iPad, whatever, remove it from that child. It will be very hard for you, because if you are the one that has been giving that child a maybe phone to watch, maybe you don't want him to disturb you, how disturb you, I'll be giving, for you to take it away from that child is going to be very difficult. Trust me. It will be very difficult for you, and it will be very difficult for the child, because the child will be frustrating you. Maybe at the time you just give it, but try as much as possible to just take away that gadget from that child, phone, everything to don't allow the child to watch all those things. Secondly, make that child to be having, even if it's 2 hours sleep. If he doesn't go, if he's not, maybe if he's during holidays, during weekends, make them to sleep. Where they are sleeping, the brain is working. Make them to have, even if it's 1 hour to 2 hours a day, maybe during weekend, they didn't go to school or didn't go to kindergarten. Make sure that that child is always having afternoon sleep. Thirdly, please, doctors cannot in fact, some doctors will not even, or therapists, they will not even advise you to take multivitamin. When it comes to that, go and look for IQ multivitamins. Look for your omega-3. Very, very important. Look for your omega-3. Good brand of omega-3. Be giving it to your child. Look for other multivitamins and just mix it and give it to the child. The only thing the therapist or the doctor will recommend is just for you to give them. If your child maybe is not speaking and is a little bit hyper, they will just give that child, even if that child is not hyper, because I've seen somebody that was telling me that her child is not hyper, nothing. It's just because maybe not understanding more. They will just give you a medicine that the child will live on. For you to just, some parents, they don't accept it. You will see that some parents, they don't accept those medicine. So for you, just go and look for these multivitamins. Take the child out. Speak with the child. Interact with the child the way you are interacting with your, like an adult. Play hide and seek with the child. Okay, when you ask the child a question, answer the question. How are you? I'm fine. How are you? I'm fine. How are you? I'm fine. Do you know, by doing that, he will understand. He said, how are you? You answer the question. How are you doing? I'm sleeping. What are you doing? I'm sleeping. So that thing that child is doing, just try to use it to answer the question. Do you get? By doing that, the child will be understanding. The therapist will not do everything for you. It's for you to do your things by yourself. If you leave therapy, I don't know what 45 minutes will do in the life of a child that is not speaking well.